And so when you go there, you have to submit the letters. They just check it and they look for the available spaces for you and the number of months or weeks you are able to intern with them, and then they will match you to consultants or specialist doctors that will teach you. And Nicholas was saying something that they explain the thing and they ask you to go and read. It is the same thing for my experience in Ghana as well. The teachers don't spoon feed. Spoon feeding means they want to give you all the knowledge, but in our medical field, reading is a key. So teachers are not going to spoon feed us. I was not spoon fed when I went for my internship. They give you the introduction of the case. They tell you this is a case, what is it is about. They give you areas to read, and so they help you to get the plural and understanding of the case. And when you go to the books and you read it, you will see that, oh, it makes sense. It makes sense because medicine is mostly about reading and it's about using your cognitive ability to get it. And so it is much, much, much easier. I think that every student who loves to read and wants to become a better medical doctor can become, irrespective of wherever you want to be. You can go to all over the world and have your internship over there. That is it. To summarize it, first you have to get your document from the school, and the school's address must be on it, and you submit it to the hospital's admission office or the administration office, and you'll be contacted, and then you start your internship. It's that simple. Every hospital is willing to take you as a medical student to intern because you'll be of an asset to the hospital. Myself, we were assistant doctors. We were taking some clinical histories from patients, helping some patients feel comfortable, and patients were so happy receiving us. It's been the same here when I was a student in Hebei North. When you used to go for our clinical studies in the hospital, patients were also willing to speak with us. They were willing to share their problems with us. They were willing to allow us to examine them, for example, examine their ears or their body, physical examination on them. So it's almost the same everywhere. It's not difficult at all. That perception must be erased from everyone's mind.
Okay,
Yeah.
all right, amazing. Okay, just quickly before we leave, Isaac, can you tell us can you briefly outline how many years it is to study medical in China?
Okay, basically it is 5 years plus 1 year internship. So let's say the study time is 6 years. And it's 6 years because it has its structure almost like the UK system, which gives you the MBBS. And it's almost the same in other countries. Some European and African countries give this MBBS, but the naming is quite different in some African countries. They give MBCHB. It's the same thing, just the lettering. Okay, so it's 6 years. It includes clinical studies. In my country, it is 6 years of full study. The internship year is divided from fourth year, fifth year, and sixth year. But in China, you are given the opportunity to have all your study, complete all your courses, and have one single year to be in the hospital 1 year to learn everything so that when you graduate, you have the practicals right on your tips. And the thing is, you need to understand that medicine is a practical thing. So the more you see the cases, the more you get in touch with patients, the more you understand them better, because a human being is quite complicated. And so the more you are with it, you learn on the job. We learn on the job. And so it takes basically 6 years of no stress. You study 5 years in China and you decide to go home for a year to do your internship, and then after that you can practice medicine everywhere you want to go to.
Okay, amazing. That's great. Okay, and I have a question for you, Nicholas. So, the healthcare field is very competitive in the world. So, what advice do you have for any youngsters that want to study? What advice would you give them on coming to China?
Healthcare.
Yes, in terms of studying healthcare.
All right. Yeah. So to study in China about healthcare, of course, it is included in the requirements or in requirements of the admission. Like when they are giving you the requirements, they explain to you how you will pay. Yeah. So in paying, you will pay among on the school fees, you will add insurance fee. So it is not a problem. You're gonna be take care of, and about the security and everything, it is not a problem. It is well secured. So there is no, it's not a country you can be afraid. Maybe somebody will slaughter me in the night. In no, no, in the night we go out, we chill, we do parties. We there is no problem. Yeah. So here, health wise, there is no problem with it. Yeah. Yeah.
Thank you so much, Nicholas. Okay, there we have it. Hope we've managed to answer all most of your questions. And okay, thank you so much, Isaac and Nicholas, for joining me in this interview.
Most welcome.